Welcome to this presentation on the Iowa Primary Care Association. This presentation provides an overview of the IowaPCA, including its history, mission, and services, as well as two affiliated organizations, In Concert Care and Iowa Health Plus, that also serve the state's health centers. A more comprehensive presentation of the services provided by the PCA is available on our website at www.iowapca.org. The Iowa-Nebraska Primary Care Association was formed in 1988 as a coalition of 3 Iowa and 1 Nebraska community health centers. With the support of 2 significant investments in health centers, the first under President George W. Bush and the most recent under President Barack Obama, the health center program in Iowa and across the nation has flourished. The Primary Care Association hired its full-time director in 2000 to meet the growing needs of the health centers, and in 2011, Iowa and Nebraska created their own individual organizations to meet the unique needs of the health centers in each state. Today, the Iowa Primary Care Association provides a broad range of technical assistance services for the state's health centers. The mission of the Iowa Primary Care Association is to promote, advocate, support, and strengthen a quality system of health care while improving access primarily for the underserved in Iowa. Known as the IowaPCA, the organization is a not-for-profit corporation governed by a board of directors, which includes the directors of each of the state's health centers. A clinical representative also serves as a non-voting board member to ensure clinical input is included in board decision-making. The work of the board and PCA staff is supported by several committees. These include Executive Committee, Clinical Committee, Oral Health Committee, Policy and Advocacy Committee, Finance Committee, Communications Committee, and Workforce Committee. These committees include health center representatives and meet at least quarterly. The day-to-day work of the IowaPCA is led by the Chief Executive Officer, who is supported by several staff with knowledge and expertise in many areas. State and regional primary care associations, known as PCAs, is supported by funding from the Health Resources and Services Administration, known as HRSA. PCAs provide assistance to health center program grantees and lookalikes to meet program requirements and improve performance. PCAs provide training and technical assistance to health center program grantees and lookalikes based on the needs of the state or region they serve. HRSA resources are complemented by other IowaPCA financial resources, including membership dues and public and private funding to carry out specific activities. With these resources, the IowaPCA provides a broad range of services including policy and advocacy, quality and performance improvement, emerging programs, workforce development, outreach and enrollment, health center development and expansion, and communications. The PCA facilitates collaboration among the health centers, with each board committee playing an important role in guiding and supporting the PCA's efforts. The Policy and Advocacy Committee guides the PCA's efforts to monitor and advocate for state and federal legislation that furthers the objectives of Iowa's health centers. The PCA provides input on state and federal policy development and insists health centers interpret and implement policy. The PCA keeps informed on state and national issues impacting health centers and communicates key information to health centers. The PCA also maintains a grassroots advocacy network to educate state legislators and members of Congress about legislation and policies affecting health centers and their patients. Several work committees and work groups guide the PCA's quality and performance improvement work, including the Clinical Committee, Oral Health Committee, Operations Work Group, and CFO and Billing Work Groups. These committees guide the PCA's efforts in many areas, including, but not limited to, expanding and improving medical, oral health, behavioral health, and supportive services, and maximizing health information technologies to improve quality and patient outcomes. The PCA also helps health centers understand and meet HRSA's 19 health center program requirements, as well as Federal Tort Claims Act, or FTCA, and 340B drug pricing program requirements. Throughout the year, the PCA offers numerous opportunities for skills development, training, and information sharing related to quality and performance improvement. As the healthcare environment continues to evolve, it is imperative Iowa's health centers understand policies and issues that will impact them and their patients and are well positioned to adapt to this changing environment. The PCA Board of Directors and staff closely monitor emerging programs and work to best position the association and health centers as these programs are designed and implemented. Currently, the PCA is focused on 3 areas: the Iowa High Quality Healthcare Initiative, through which the state will implement a managed care approach for Iowa's Medicaid program, identifying partnerships with and interventions that can improve the social determinants of health-impacting health center patients. These determinants are conditions in the environments in which people are born, live, learn, and work that affect a wide range of health, functioning, and quality of life outcomes and risks. The PCA monitors the development of innovative delivery and payment system changes and working to identify resources to test new models in Iowa. The impact of health centers in their local communities relies on maintaining a skilled and knowledgeable workforce. The IowaPCA supports health centers by offering provider recruitment and retention assistance and ongoing training opportunities for health center staff. The Workforce Development Committee advises the Board of Directors on workforce initiatives and undertakes projects in support of the development and expansion of a strong workforce in the state's health centers. The Recruitment Center provides participating health centers with comprehensive candidate sourcing and screening activities for physicians, dentists, nurse practitioners, and physician assistants. The PCA also supports health center recruitment and retention efforts by publishing a comprehensive compensation and benefits report every other year. This report includes information for all health center clinical and administrative staff positions. Each year, the PCA offers numerous educational opportunities for health center staff, including workshops, trainings, webinars, and the annual conference. These events provide staff with a venue for understanding issues impacting health centers, learning about best practices and challenges facing health centers, and sharing their own experiences with health center colleagues. With the increase in healthcare coverage opportunities made possible through the Affordable Care Act, there has been an increased investment in health center outreach and enrollment staff. To support the work of these individuals, the IowaPCA provides ongoing assistance to certified application counselors through regular conference calls, email updates, trainings, and one-on-one technical assistance. The PCA also serves as a common point of contact for state, federal, and nonprofit organizations to communicate with health centers about outreach and enrollment news and activities. The Communications Committee advises the board and staff on PCA initiatives and undertakes projects in support of the health center's marketing, development, and communication efforts. Guided by the committee, the PCA staff develops educational materials for members to tailor for use in their centers and communities. The PCA utilizes several communication tools to keep health centers informed about issues affecting them and to educate stakeholders, partners, legislators, and the general public about the impact of health centers locally and throughout the state. These include the Friday Update, the Iowa Community Health Centers Profile and Legislative Agenda Book, PCA website, and multiple social media outlets. The PCA maintains numerous email list servers for health center staff to communicate with and learn from their colleagues across the state. Each listserv is tailored for specific health center staff, such as financial, medical, oral health, behavioral health, pharmacy, human resources, and IT. Because there is still a need for affordable health care in Iowa, the PCA provides development and expansion assistance to both established health centers and to communities without a health center presence. The PCA offers comprehensive services to assist communities in determining if a health center is an appropriate fit for their area. The PCA also assists health centers applying for HRSA funding opportunities, such as service area competitions and service expansions. Because health centers are an important part of the overall healthcare system, it is important that the IowaPCA work in collaboration with other public and private organizations to achieve the association's mission. State, regional, and national partnerships allow the PCA to share information and undertake joint projects and activities to provide comprehensive healthcare services for the underserved. The IowaPCA maintains informal partnerships with numerous state, regional, and national groups. A sampling of PCA partnerships is listed on the right. The IowaPCA has close ties with two affiliated companies, In Concert Care and Iowa Health Plus. In Concert Care is a health center controlled network formed in 1997 by several Iowa and Nebraska health centers. In Concert Care assists member health centers in improving access to health care, maximizing the quality of their services, and achieving cost savings by using information technology tools. In Concert Care helps health centers to adopt and effectively utilize health information technology, such as electronic medical and dental record systems, to improve quality and patient outcomes. Iowa Health Plus is a clinically and financial integrated network of Iowa health centers that serves as Iowa's Medicaid's and potentially other healthcare payers' primary partner for shared services and value-based payment initiatives with the Iowa Health Plus members. Iowa Health Plus helps participating centers ensure that clinical standards are met to ensure high-quality, affordable care is provided to health center patients and reported to payers. Iowa Health Plus is partnering with the managed care organizations, known as MCOs, that are managing Iowa's Medicaid program. This partnership will mirror and build upon the current partnership with Iowa Medicaid, with a long-term goal of entering into value-based contracts through which providers will be paid based on quality rather than quantity of services provided. As you can see, the Iowa Primary Care Association plays an important role in supporting the state's health centers to achieve their mission to provide affordable primary health care for the underserved. For more information about Iowa Primary Care Association and the Health Center program, visit the Iowa Primary Care Association website at www.iowapca.org, the National Association of Community Health Centers at www.nachc.com, and the Health Resources and Services Administration Bureau of Primary Health Care at www.bphc.hrsa.gov.